So after discussing about the causes of subacute meningitis, and in the first section we talked about the Mycobacterium tuberculosis and also some fungi which are associated with subacute meningitis. Now in this section we will talk about some lab diagnosis which can be done for the diagnosis of subacute meningitis, and also cryptococcal polysaccharide antigen test. So lab diagnosis, classic CSF abnormalities associated with subacute meningitis. We have elevated opening pressure. So increased intracranial pressure, increased opening pressure is present on the lab finding of cerebrospinal fluid. And this cerebrospinal fluid is the fluid that flows around the brain and spinal cord in between, and it gives a protective cushion. And when different infections are present in the central nervous system, it can cause increased in the intracranial pressure. And lumbar puncture is the procedure that is performed to remove this cerebrospinal fluid, and it's a long needle used, and it's performed between lumbar 3 and lumbar 4 region, and the cerebrospinal fluid is removed, and it's very, very helpful in the diagnosis of different conditions associated with the central nervous system. So there is elevated opening pressure. Then we have lymphocytic pleocytosis. Increased lymphocytes are present. There is lymphocytic pleocytosis in the cerebrospinal fluid tests. Then there is also elevated protein concentration in the cerebrospinal fluid, and there is decreased glucose concentration. So very, very classic features of on the examination of cerebrospinal fluid are present in the subacute meningitis lab work, which is performed on cerebrospinal fluid. There is elevated protein, there is decreased glucose level, there is lymphocytic pleocytosis or increased number of lymphocytes, and there is elevated opening pressure. Again, in the lab diagnosis, there is unrelenting headache. So on the physical exam of the patient also, there are some features which are very, very characteristic of the meningitis. So we should look for that also, and then further our diagnosis and confirm the diagnosis by further lab work. So there is unrelenting headache, stiff neck, fatigue, night sweats, fever with cerebrospinal fluid, lymphocytic pleocytosis, and mildly decreased glucose concentration is highly suspicious for tuberculous meningitis. So if we have all these findings with the lymphocytic pleocytosis, night sweats are very, very important finding associated with tuberculosis and tuberculin infection. If all that features are present, and there is also decreased glucose concentration, we should think that this is the tuberculous meningitis. Smear for acid-fast bacilli. The Mycobacterium tuberculin is the acid-fast bacilli, so we should do the smear for acid-fast bacilli. That's the histological appearance of the tuberculin bacillus. So we should do the smear for acid-fast bacilli. Last tube of fluid at lumbar puncture is best. So when we perform the lumbar puncture, the smear should be, the specimen used for smear is the last tube which is obtained at the lumbar puncture. That's the best for the smear. Pellicle in cerebrospinal fluid or cobweb-like clot. Acid-fast bacilli in smear of clot or pellicle is also an important diagnostic point for the Mycobacterium tuberculosis. Positive smears, if the smears are positive for acid-fast bacilli, in 10 to 40% of cases, these smears are positive. Culture, gold standard to make diagnosis of tuberculous meningitis. So all these different lab tests are performed to further confirm the diagnosis of Mycobacterium tuberculin meningitis or tuberculous meningitis. We already said that the clinical appearance, clinical examination with the patient with the headache, neck stiffness, then on the examination lymphocytic pleocytosis with some mildly decreased glucose concentration gives the idea that this is the tuberculous meningitis, which is further confirmed by acid-fast bacilli testing on the cerebrospinal fluid. Then we can do the culture also, and the positive smear are present in 10 to 40% of the cases. Polymerase chain reaction nucleic acid amplification tests are also performed. Cerebrospinal fluid abnormalities now in fungal meningitis. So we talked about tuberculous meningitis, lymphocytic pleocytosis, increased protein, decreased glucose concentration is the tuberculous meningitis. Now what are the findings in the fungal meningitis? And that's the histological picture of fungal infection. In this, there is mononuclear or lymphocytic pleocytosis. So lymphocytic pleocytosis was also present in tuberculous meningitis. In fungal also, there is mononuclear or lymphocytic pleocytosis. Increased again protein concentration, decreased glucose concentration, eosinophils in cerebrospinal fluid in coccidioides immitis meningitis. So pretty much the CSF findings are the same between fungal and the tuberculous meningitis. Spinal fluid examined by lumbar puncture, not yield organism. Cerebrospinal fluid obtained by high cervical or cisternal puncture. Now, cryptococcal polysaccharide antigen test. Highly sensitive and specific test. These are the steps in which we perform this cryptococcal polysaccharide antigen test. Simple test, like lot of in-office tests that are usually performed, like strep throat test, pregnancy test. This cryptococcal polysaccharide antigen test, which is highly sensitive and specific for cryptococcal meningitis. Histoplasma polysaccharide antigen fungal meningitis, not specific for meningitis caused by Histoplasma capsulatum. may be falsely positive in coccidioidal meningitis. So it's very, very specific for cryptococcal meningitis. And in this, add 1 drop of specimen diluent to tube. Add 40 microliter patient specimen to tube. Insert strip here. This is the strip that is inserted, and then wait for 10 minutes. After, we have positive 2 lines, negative 1 line. So mostly the same test we can perform in the office, like for strep test or pregnancy test, in which we add 1 drop of specimen diluent to tube, and then we add the specimen, and if 2 lines appear after 10 minutes is positive, otherwise it's negative. And it is very, very highly sensitive and specific for cryptococcal meningitis. So it's called cryptococcal polysaccharide antigen tests. That was all about section 2. Thank you for watching sqadia.com.